So good morning again. So
Okay, Noel, we'd
yes.
like to introduce our next speaker.
Yes.
May we ask everyone to please take a seat?
So the first of our plenary sessions
Sorry.
will be the overview of the DLSU IBEHT, and that stands for Institute of Biomedical Engineering and Health Technology. So to give us that plenary lecture, allow us to introduce Professor Nilo Bugtay. He is the Executive Director of the DLSU IBEHT in Laguna. Professor Bugtay.
It was so nice to hear our secretary have a full support of our project under IBET. So this moment, I would like to describe and give you the overview of IBET. What's IBET? And how long we are now in the La Salle. Okay? So bear with me and I will give you IBET. This is my outline. So just a sense of history. So the biomedical engineering research is not yet a program at the time, but we did a lot of research through our mother department in De La Salle, which is the manufacturing engineering. And in 2001, 2003 and 2004, we have split, meaning we form a tracking. So we have mechatronics and robotics as well as biomedical engineering. So this is the program where the biomedical engineering really established with an EU funding through the Asian program. So there are 3 universities on it: University of Pisa, University of Sweden, as well as University of Indonesia. Right now, De La Salle offered the bachelor's degree since last year of biomedical engineering, as well as MSc in the biomedical engineering. So from a research group of about 15 researchers, now it grows to IBET. So this is the very popular agapay made of a 3D printed components. This was in 2017, I think. So this is the first agapay prototype, which now have the Singapore patent. Actually, we filed in the US, we filed in Thailand, Malaysia, and in Vietnam. Of course, this is through the funding of the DOST TAPI. Aside from that, during the time, again, with the group of the Biomedical Devices Innovation and eHealth group in De La Salle, which I headed, we also have this laparoscopic conventional equipment. So I think many of you have done this kind of operation or surgery. And even before this patent of the agapay, the motor actuated laparoscopic has been already patented by our local IPO field. Okay? And it goes into this different version. So we have a motor actuated, but if you're going to say in the far left, it's something that's really like a spaghetti type, and we modify, make it more handy. But again, because of the weight, there's no way that we could include that, or the doctor could carry at all, or the procedure. So now, for Lapara, we're now looking into automated, made in a robotic, operated. And we have already conducted pig cadaver at St. Luke's for this. And it was really a success, the doctor said. So there are some findings and issues that we in that time during 2016, 17, 18. But because of the DOST initiative, we're able to fulfill many of those issues. For example, the facilities that the DOST have constructed and built, so like the EPDC for the electronic testing, okay, the ADMATEL, and of course the AMSEN. These are so good for a researcher to know that the DOST have supported all these researchers' activities. So the program, sorry for that, was initially approved by the DOST PCSRD, IBET, Establishment of Institute of Biomedical Engineering and Health Technologies. And it was approved in September 18, 2018 as a program with two component projects. Then we established our mission vision that by 2025 we can achieve this. I will tell you why next. Then IBET is a one-stop shop for all information support for anyone who would like to do research in the biomedical devices and health technologies and of course hospital equipment. It's a lab-to-market roadmap. We include the roadmap for all of this research because the DOST PCSRD have supported a lot of money from the people's tax. And of course, go-to centers. So we have already more or less established our centers or sub-centers in the institute, neurorobotics, robotic rehabilitation, and assistive devices, robotic surgical devices and technologies, and even we have established the commercialization hub. All of this project that we have mentioned is supported by the DOST. And also we have some, like, we can recommend to the DOST ECI or scholarship for international programs as long as you will take MS and PhD in the biomedical engineering all over the world. So you can choose which university around the world. And with our guidance, then easily you can get the acceptance. This is our framework. We work on that. So seeing that our program is really increased around 2018, the following year, our Vice President for Research and Innovation asked me to prepare a proposal to the President's Council. So I prepared and proposed to different councils. And eventually, in July of 2019, a year after, IBET is now recognized as a research center, one of its academic unit. So they asked for our structure. We have this, even with our research lab, we have our structure also. And we have our advisory council when we started in 2019. And Professor Charles Yu is one of them. We need his expertise. So right now, I'll give you the summary of what we are doing in the past maybe 2 years.
Some of the problems faced by the medical industry in the Philippines are the economic disparity in healthcare, lack of access to high-tech medical devices, and dependence on imported technologies. With these problems, we realize that there is a need to develop these devices. This is why the De La Salle University Institute of Biomedical Engineering and Health Technologies was proposed to bridge these gaps. Dr. Bugtay was inspired to start this research institute after his visiting professor stint at the University of Pisa as part of the Asia Link program funded by the European Union, developing competencies in biomedical engineering. Opportunities to collaborate with different projects from different universities came in the years to follow after his return. With the experience he accumulated, he was eventually able to establish the Biomedical Devices Innovation and e-Health Research Group by engaging with research in robotic rehabilitation and surgical instruments funded by the PCHRD. IBET aims to also be able to address the following needs: common service facilities, a platform for exchange of information, and the need for more experts in the field of biomedical engineering. IBET plans to address this with a framework that includes capacity building of the biomedical engineering field in the Philippines, collaborations, lab-to-market roadmap, and one-stop shop for biomedical research. There are currently about 6 projects under IBET. The Agape project is a wearable robotic exoskeleton that aids the post-stroke or injured patient's upper limbs to perform a range of motion that eventually helps regain their motor control. The Lapara project is a laparoscopic instrument that will improve the maneuverability of a surgeon in the operating room by integrating joint articulation, robotic arm control, haptic and visual feedback, and an ergonomic workstation. The Tayo project is a robotic device for early trunk and lower limb rehabilitation that helps restore the patient's lower limb strength and range of motion. The DO project is an impervious wireless intravaginal monitoring sensor device that aims to determine the peak estrus by monitoring the overall estrus cycle of a goat. The Capacita project aims to be able to teach the skills and knowledge needed in the commercialization of biomedical engineering and health technologies to researchers, inventors, technology transfer officers, and related personnel. The Kandili project is a competitive intellectual property management system to be able to commercialize biomedical devices, hospital equipment, and health technologies through the IBET programs effectively and efficiently. Project Agapay, Lapara, Tayo, Do, Capacita, and Kandili are the current projects being handled by IBET. As we continue to innovate the industry through our current projects, we will also be talking about our upcoming projects. The current status of DLSU IBET is that of a niche center in the region for research and development in medical robotics. From the categories of R&D, the establishment of a neurorobotics technology center in the Philippines will be the first official program of the newly created DLSU IBET NICER program on medical robotics, which aims to focus on the last thrust, which is neurorobotics. The Neurotech program will be multi and interdisciplinary in nature and will establish 3 component projects: the Celia project, Ibalik project, and Sigla project. The program will be headed by Dr. Roy Francis Navea, an associate professor from the ECE department. First project commenced under the Neurotech program is the Celia project, which is headed by Dr. Nilo Bugtay. The first project is a wheelchair that operates on the user's brainwaves, meant for patients with physical disabilities such as autoimmune disease, motor neuron disease, spinal cord injuries, and more. Another IBET-approved project under the Neurotech program is the Ibalik project, a cognitive and motor function rehabilitation using neurofeedback training system for stroke patients. With Dr. Mirna Estrada as the project leader, the group aims to incorporate the concept of Ibalik, which means to restore. The third project under the Neurotech program is the Sigla project, headed by Dr. Roy Francis Navea. It is a neurofeedback therapy solution designed for people diagnosed with depression, and the idea came from the concept Ibalik ang sigla, something desired for people with depression. IBET has several plans for its future, increasing the R&D collaborations for the biomedical devices innovation and health researches, IP protection for all research projects and commercializing IBET's developed devices, increasing the quality of publications and referred journals, establishing go-to centers for biomedical devices and hospital equipment, fundraising to construct a building to house the different research centers, transforming IBET into a university institute, and lastly, to spearhead the creation of the Philippine bioregions through the NICER program. What are Dr. Bugtay's thoughts, experiences, and realizations through his journey? Overall, he believes it was a deeply meaningful learning experience. He learned that making connections with other international researchers helped bear fruit to new and more innovative ideas. He realized that the original thought may not have been wrong, but there could be other ways to achieve your goal. Cost isn't everything. The important thing is what you bring to the table. What makes your product better than what's already being sold?
Okay, what's the update of those projects that is funded by our government? So the Agapay, the Lapara, Tayo, and the Neurotech program, which has 3 projects. So currently for Agapay, so this is the question of so many newspapers and TV outfits going from one. So I have 6, 7 appointments, but I always delegate it to my researchers. It's not for me to have done that already. So for Agapay, we need now the clinical trial phase 1, which is the healthy subjects. Once we could collect all those data, now we can proceed to the stroke patients. And that's the status of Agapay. It's ready for the healthy patients, but need to be approved for our clinical trials by the protocol that we have designed. Then, of course, there are some current, but it's manageable, so we can do it. For the team, so you can just imagine how many teams that I have. We have medical doctors, we have engineers, we have business people, we have IP practitioners, and all of those. Because we need that during the during the GC, Sick Boy have said, oh, kailan natin madadala yan sa market? Dok, alam mo naman, iba yung ano ng ano, di ba, medical. So, but if you are only taking into the technical side or even the medical side, it's not right. So you have to have a holistic approach on this. So for Lapara, again, we have still on the stage 2, meaning we have conducted already the pig cadaver. So this July or August, we'll be going to have a live pig test. And then you have another team that then tayo, this is Secretary Sulido there is for lower extremities. So we have, so it's always gamification so that the patient will not be irritating or bored to conduct all of these sessions that they have. So it's like, the principle is like a tell table, but this time you have different angles where all your parts will be exercised, of course, with the gamification part. And all the muscle movements have been captured in a database. So you can really say that you have improved last session. Okay? So those are the things that we input to them. Again, you have the team, and then you have Celia. This started last June, but as I've said, this is a nicer approved program wherein it's the Science for Change program have approved. So still very, very early, but I think of all the 3 projects that I mentioned, I think by next year, Secretary Solidum, we can bring it to a pre-commercialization already. The team, of course, the SIGLA project, as mentioned, for rehabilitation, and of course, the team, and Ibalik, which you can find some of the posters there. So, what are challenges? Okay. So, number 1 is ethics. If you are going to look at the 3 projects like Agapay, Tayo, and the Lapara, these are hardcore, big bulk medical devices. So, our let's say, the ethics is not ready for yet. So that's why it's so hard to proceed until that is being approved, then we cannot conduct the So that's one problem that we have. I already consulted several people like Dr. Montoya how to go about it. But again, because there are no basis yet in our country for these hardcore devices and hospital equipment, then still need to discuss further. And other delays, of course, accounting, procurement, as usual. So what are achievements now? So as mentioned, Agapay as I've said, 5 countries we mentioned, and it is funded by the DOST, facilitated by DOST TAPI. And the piling for Singapore, it was funded by the UPTBDO. Sila nag-file kasi we are having this collaboration. So sila yung nag-file because we have memorandum of agreement with this Agapay project. So that's another. And just last January, we're surprised that we're given this 2022 NRCP Most Outstanding Institution Award. So it's an honor that we're able to receive this. Barely less than 5 years of existing. So really an honor for us. And of course, this is one big thing for us. Even Doc Montoya said, wala na ba ibang donor dyan? When we started, we just joke around. Okay yung program natin, tapos na-approve pa ng Lasal, yung as academic unit. Sana may mayaman dyan na magdodonate ng building. Di ba? So, I still believe dreams comes true. Di ba? So, yan. So, may nag-donate sa amin with all so many things. And when the brother president presented it to this donor, he said, alam mo, this is the dream of my wife because my wife is always working with the marginalized and the sick people. So tamang-tama, pinagsabi, you're heaven sent, so ang sabi. So now the building is being prepared. So everything now pinapan yung that is about 5-story building yata. So we can dream, and when you dream big. 300 million is not that liit, di ba? So we're happy to have IBET having a building already in the Paiza zone of Laguna campus. So again, as mentioned, we are designated as the NEED center of the region in medical robotics by the NICER program, Science for Change. And of course, I have to work because this is the campus of Pablo Campus Award. So yours truly, then an RP lead of the Ateneo de Zamboanga, and I also was in the innovation. So sabi ko, ayaw ko ito ipapakita kasi parang buhat ko yung bangko. Sabi na, sino makakilala sa'yo kung hindi mo ito ilagay sa labas? Nagsabi sa yan si Doc Montoya, pakilala mo yan kasi yung perang pinagastos namin sa project nyo, dapat alam kung sino yung nagli-lead. Di ba? So, okay. So, this is another milestone sa amin. Remember, when we were in lockdown, wala kami magawa. All our computers, our equipment, pinadala namin sa bahay, sa mga researchers. Hindi ka makalabas ako, senior na, di ba? So, wala kang labas. So, buongan, So, what we do is to create proposals and submit to different funding agency. Itong tulay na to, we submitted to MRC, UKRI MRC, GPRC, tapos may SPREC pa. Ito pangatlo in IHR. And about 2 years in the making. So it's a substantial amount, around 1.8 million pounds. Of course, we have partners, but almost half of that went to our in the Philippines because we are now the implementing institution. So it's something that you never dream of. So I said, dream big because even you are declined 3 times, pag-port pala pwede, di ba? So, yan. So, totally, we have a funds around from 2016, about 300 or more, actually. So, facilities. So, this is what I told you that our institute can recommend. So, I already opened it to several institutions, Luzon, Visayas, Mindanao, that you can apply as long as you will do your MS, PhD in the biomedical engineering program, and you apply with our endorsement sa SEI DUST. Of course, we have now people from Ched Newton, which is also under our institute, who's now doing his postdoc, and he will be returning soon. Alex is an ERDT scholar, and he's already submitted the revise, so he's also working with us at IBET. Ira just came in, but he will be defending his thesis by June. And of course, we have several webinars. We have already organized 2 national conference on biomedical engineering and plans. So increase, as mentioned, so we have collaborators, foreign or national companies, and protection of our IPs. The Agapay project received 3 patents from iFulfill. And we have another 5 for filing. And 3 of them is PCT, Patent Cooperation Treaty. Okay? So that's one. And of course, we have sa patents filed several Scopus publication. Students, we encourage students who want to do a OGT ranging from 3 months to 1 year, actually. And it's open to other universities, even not in LaSalle. Fundraising, so you know the story. So we're given a 300 million for, so it's a big dream. And maybe this one just a very running to, when we think about how we can commercialize it, as Dr. You have said, na hindi tayo nag-iisa, hindi tayo. So what we need is collaboration, 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 and collaboration, local or international. So I propose this to the brother president with his council, is like a lab to market strategy for R&D in biomedical devices. And this seems to be okay. So what I told them that, but the key aspect here is the building. If the building will be there, then another dream comes true. Okay? So just a concept, so just to have this, it's not originally mine, but I saw a lot of science park around, especially dealing with biomedical devices. So isang nakikita ko na medyo malapit-lapit sa atin is the Hinchu in Taipei. So like IBET, this one is for IBET, then hospital liaison because we cannot really create hospital or build. Then there is a commercialization, and we have the academic professional, meaning the CPD and all those things, and train all the expert or train the trainers, okay, so that everything will just coincide. So this is just a concept, but every center of this have really a very detailed thing that we have thought of. Of course, this is the mission statement and all of these things in place. So where is it located now, the building? Because this is the key aspect where we could really build the science park. It is that orange, that is the Laguna Peza zone of the LaSalle. The LaSalle is 54 hectares, and we're given 10 hectares for the Peza, and our building is somewhere on that. So building the ecosystem, and maybe we could have research, advancement, business development, capacity building that will give us benefits. And of course, we have this timeline, and hopefully we could achieve that. My takeaways. So there are a lot of, I saw high schools or college students here. So I will say to you, never give up and always strive for excellence. Kasi ito yung kailangan natin. The road is not straight, crooked, or even paikot-ikot pa. Diba? But remember this, life is just too short to be ordinary. So leave a good mark. Okay? So how? Do this. There are so many problems in the world. Diba? Poverty, pandemic. But remember, if you're doing research in the biomedical devices, health equipment, health technologies, just have this in mind. Connect with the right people, with your team, engage with collaborative research, keep up with the trends, and of course, protect your valuable ideas so that you can have this in your own. And as mentioned, in our, let's say, mantra, and everybody knows it in IBET, and I did not really originate it, but I have all this contribution from my researchers that eventually we can have a new manufacturing industries that will manufacture biomedical devices and hospital equipment. We will not be depending so much of all these important things. As reported by HSTAC, HSTAC now I think it's in the OST, that still 99.2 as of April last year, the dependence in our imported medical devices. So with that, I would like to say thank you so much.